this had to work. That's what was going through my mind.
I felt that I was sliding into a dark place in my life.
I would have had surgery, would have had this internal device put in. I don't know what else would have happened if I didn't meet him.
What we do matters for patients in a life and death situation. It's just you have to be on all the time. I know that everything is going to happen the right way in a few seconds. You're about to watch it.
AGH has a decades-long history of leadership and innovation in terms of advancing cardiovascular techniques and procedures. We couldn't be more appreciative of the collaboration and the support of the Mario Lemieux Foundation.
The 2019 gift was very exciting that we were able to pretty much start our electrophysiology research program with that.
This program and what we're going to do for the health of the entire region is to build a championship program, and this is just the beginning of the investment.
Electrophysiology is a field that intersects a lot of the patient's other medical conditions, and the treatments range from medications to procedures to implantable devices.
Dr. Tassani and his team have created a culture of teamwork, and it's not surprising that it relates to us. Our chairman was a team player. He was a team owner. He understands the importance of teams working collaboratively together.
Met Mario the first time, talked about having AFib, and I would just like to say thanks to him. Because of his generosity, all of us are gonna have better lives. My PCP found out that there was an irregular heartbeat. The hardest part for me was Jada, because we had just lost my wife. So I was a single parent. I did not want to leave her.
And Jimmy's done remarkably well after undergoing catheter ablation, and really is an example of the impact that we're fortunate to have for many of our patients in improving their quality of life.
My body is back to being the way it should be, and I plan on being around for a long time.
Alexis had an event that has been really in the public's eye. Everyone knows what happened to Damar Hamlin, and less than 10% of patients who have a cardiac arrest survive. And Alexis is one of those survival stories.
I woke up that day, I was 36 weeks pregnant, went to school, I was feeling great. Before I knew it, I woke up in Forbes. The doctors had alerted me that I went into cardiac arrest at school. Our school nurse, she performed CPR and used an AED to bring me back to life. They decided it was time to induce me and bring Dominic. Yeah. December 15th, he came into the world. That's when Dr. Tassani came in and he said, we're gonna come up with a plan. And then by December 18th, I was being discharged thanks to Dr. Tassani. I was a new mom, leaving the hospital with a brand new baby. I had him to worry about as well as myself, and Dr. Tassani really helped my family, and I feel safe and secure. Dr. Tassani had us buy an AED for our house, so this is my own personal device. Is he messing this up? Okay, this is real. Huh. This is real. Huh. It's as real as it gets.
Putting this money with Dr. Tassani and his team and AHN, that's going to help in the recruitment, that's going to help in the retention right here in Pittsburgh. They make giving easy.
I wouldn't have come to AGH without it. It really has made it a better place for patients and for my life. You're gonna make me cry.
I had always been a high-energy person, and all of a sudden, even my grandchildren pointed out, like, gee, buddy, why are you just sitting in a chair? You never sit in a chair. I feel lucky because I've gotten to meet this team at the Cardiovascular Institute.
And they always, hey, Jimmy, how's it going? How's Jada? How's this? How's that? It's more like a family.
The way we care for each other in addition to our patients, the way that we are not satisfied with stagnation. We always want to be better than we were yesterday, delivering the type of care that you'd want for your family members, and there's nothing more important to me than that.